Hello and welcome to RWeb's Pain Free Without Pills webinar. Today we're going to learn about acupuncture and touch for health. My name is Parm Kaur and I'm the founder of RWeb, which is dedicated to bringing you the very best information about available alternative therapies. As some of you know, I have been using alternative therapies for quite a long time, over 25 years in fact. When I first started feeling unwell just after university, I was sent by the doctor, like many people are when they're first diagnosed with fatigue problems, to the psychoanalyst, which I didn't like at all. But thankfully, I was referred by friends to acupuncture and touch for health and found relief that way. Not everyone, of course, is that lucky, and some people don't have access to the information they need, either because they're incapacitated or because they're physically isolated and don't live near to alternative communities where they can get the help they need. So this is for people who'd like to know more but find it difficult to actually physically get out and meet people. Each of the webinars is going to be looking at a different area, as we all know that one size doesn't actually fit all. What might work for your neighbours might not work for you. So don't listen to anyone else but your body when you start thinking about alternative health therapies. We're here today to help you make the right decision and find the best for you. Some of the therapies we're going to look at might be familiar, like acupuncture. You might have heard of them, and some of them might not be so familiar, such as sound therapy, for example. But I'd like you to keep an open mind. So remember, at any time you can ask questions, put them into the chat box, and we will take as many questions as we can. You can also join the Facebook group for pain and stress relief strategies and contact our web.site at any time. So let's start now. Today, we're going to first look at acupuncture. So what is acupuncture? Looks at the opposites, black and white, yin and yang. And this is a very simple way of looking at what happens inside our body. So first of all, who uses acupuncture? Well, over 3.5 million American adults receive acupuncture treatments every year, and they use acupuncture for relief from a variety of illnesses and aches and pains. But if you haven't used it before, it can seem a little mysterious. So, we know that acupuncture is about balance, yin and yang, black and white, but it's also about how energy flows around the body. And in acupuncture, there are 12 basic meridians, which are essentially energy channels around the body. And these channels or meridians are associated with a different organ inside the body. Acupuncturists believe that when we're ill or in pain, this is because of a blockage in one of these channels. And these blockages can be removed through the insertion of needles. Now, it might not seem so strange to believe that something like a headache is actually a symptom of something gone wrong in the body. But we're all used to reaching for painkillers. and that will take the headache away, but it won't necessarily take away what lies behind the headache. And this is the wonderful thing about Chinese medicine. It doesn't just look at the symptom, it looks at what is behind the symptom. There have been a lot of scientific studies which have tried to show how acupuncture works. But essentially, the electrical systems of the body, because everything inside the body works through its own type of electricity, its own type of chemical reaction, these can be measured, but are not always measured to the same degree as conventional medicine would like. So believe you me, once you've had acupuncture and seen and felt the benefits, you won't really care to listen to too many scientists about exactly how it works, because you'll see that it works. However, if you haven't used acupuncture, you might be a little bit scared about the whole use of needles. And I can assure you, these needles are extremely thin, they're sterile, they're single use, you can't be hurt by them, and the most you will feel is a mild tingling sensation. They usually stay in place for 10 to 30 minutes, and that is the length of a normal session. Now, some people say, well, I tried acupuncture, but it didn't work. Well, acupuncture, like most traditional medical systems, does take a while to work, but it might not be the most effective treatment for you. So if you don't see any relief after a certain number of treatments, discuss this with your practitioner, and it could be that you could benefit from something else for that particular ailment at that particular time. But that's enough from me. We're now going to talk to the expert. Dr. Shiroko Sokitch is a medically trained doctor who has also embraced Chinese medicine and has been working in her own medical center for some time, and recently released a wonderful book called Healing When It Seems Impossible. So let's say hello to Dr. Shiroko now. Hi, Doctor.
Hi there. How are you?
I'm really well, and how are you?
Excellent. Nice to be here.
Fantastic. Yeah. Good. Well, thank you for being here. And I'd like to start by asking you what drew you first to acupuncture, especially coming from, the background of being a trained doctor.
Well, I was in a surgical residency, and I was not entirely satisfied with what I was doing. Mm-hmm. And when I'm going to backtrack just a little, but when I was 5 years old, my great-grandmother was my best friend in the world, and she basically collapsed in front of me one night, and we had to take her to the hospital, and I never got to see her alive again after that. And my mom came and told me a few days later that she had died, and I didn't know what that meant. So she said, well, her heart stopped beating. And I was devastated, but I didn't really understand what it meant. And when she said her heart stopped beating, I thought, well, okay, well, if we fix her heart, then she'll come back. So I started imagining how you would fix somebody's heart when it's not beating. And imagined even a machine that would get her heart beating. And I think in that moment, that's the day that I decided that I wanted to become a doctor. But it also decided at that moment, or had some sort of belief that miracles could happen, and I wanted a miracle to happen. I wanted her to come back, but I've kind of since then lived my life that way. And so the first time I got to save a life was in the emergency room as a medical student, and it was a guy who had a gunshot wound, and we took him to the operating room and we saved his life. And so that's why I chose surgery, was because that was this instant relief or instant fix. And so I went into surgical residency, and I quickly began to see that there was more that I wanted to help people with. And there was more that I needed help with, so because sort of around the end of my first year of residency, I began to experience some of my own emotional traumas from my childhood and things like that. And didn't really quite know what to do with it, but I knew that I had to do something about my own inner turmoil. And I had to also figure out what I wanted to do to help people. And there were a few things that happened to patients that sort of triggered me. But I ended up taking a month off my residency to try to sort of sort myself out. And I had a dream that if you stay in surgery, you will die during that month off. So I was like, okay, now what? And I was so seeking something, but none of the conventional medical specialties at the time appealed to me. So I began reading books, and somebody gave me this book called The Web That Has No Weaver. And that was about acupuncture or in Chinese medicine. And I just fell in love with it. Literally, I fell in love with it. And the ideas of it. And you did a little bit of explaining of how Chinese medicine works. Acupuncture is only one element of Chinese medicine. The concept of Chinese medicine is really all about balance. And when there's something out of balance in your body, then you have problems. And so the idea is that you want to get your energy in balance so that you can heal. And the whole idea is that your body knows how to be healthy. And the point of using needles, literally the point of using needles is to help reestablish an energetic balance in the body so that it can heal itself. And so that it can remember what that healing was meant to be. So that, I think that I answered your question, but I went on and on. I've been practicing Chinese and Western medicine together for almost 30 years. And I've had my medical practice in Santa Rosa, California for 25 years. So I've been doing this for a while. And I wanted to share with people what it takes to heal. And there were many things in my path as a healer and as a human that have shown me what it takes in order to heal. And so I wanted to share that. Mm-hmm. Of course I can. So in Chinese medicine, you mentioned this in your intro, 12 meridians. So there are 12 basically pathways that energy travels in your body, and those are based on your internal organs. And how the internal organs work in Chinese medicine is different than how they work in Western medicine. And every organ has physical functions and emotional and spiritual functions, in addition to what we know already from our Western understanding. And I always add it together. So I have Western medicine and Chinese medicine, and to me, they're one big picture. But the understanding of the organs from the Chinese perspective helps you understand your own body better, actually, I think. And every organ has an emotional connection and a physical connection and spiritual. So for example, the liver, the liver has, it regulates the smooth flow of energy in your whole body. It regulates your menstrual cycles. It regulates the emotion of anger. The sensory organ that the liver is connected to is your eyes. So like if you have problems with your eyes, or you have problems with your periods, or you have tight neck and shoulders, those are all things that are connected to your liver energy, in addition to the liver's Western job, which is detoxification. And so let's say you're a person who tends to get angry at everything. You might also have other physical symptoms that go along with an imbalance. Or you may not be aware of having anger, but you have all these physical symptoms like period problems or burning eyes or tight neck and shoulders, or the liver also regulates your ligaments and tendons. So you might get easily sprained or strained. Those are all liver imbalance. And so then you would start to try to figure out, well, how could you help your liver be more balanced? And so, yeah, so I guess that's all I want to say about it. Mhm. Mhm. I have never had anybody have trouble understanding that when I explain it. So I haven't felt like it's an issue really, in terms of if somebody, to me, how I look at it is, let's say you sprained your ankle. You just had a normal sprain. So some things seem to be purely physical, and they may get better quickly. So so you sprained your ankle, and in a couple of weeks you're able to walk again, so everything's fine and you just go on about your life. But let's say you sprained your ankle and it got really swollen and it was red and hot and painful for weeks, and it wouldn't get better, and even when you took an x-ray and the x-ray looked normal, and it's still in pain and you're struggling. So when you have something that isn't getting better in the way that one would normally expect it to get better, you begin to ask questions. And this is not me asking questions, it's you asking a question, like, why isn't my ankle getting better? And so then you start to ask questions and you look into it further. And when people get to that point, or when they get to the point when they ask enough questions that they show up in my office, they're ready to hear that emotions and spirituality and all of those things are connected. Your body is not just a physical body, it is an emotional spirit. Your spirit lives inside your body, or actually you live inside your spirit, right? And your body is just a small part of your spirit. And I think that I don't think it's such a far-fetched concept for people to understand. So I'm going to say that I've had no trouble explaining that. Parm, I can't hear you.
Can you hear me now?
Yes, I can. Yeah.
That's fantastic. So let's just imagine that someone is sitting at home thinking, "Oh, I think I want to try acupuncture."
Mm-hmm.
Is there something they can start to do today, for example, to get themselves into the right mindset, or to take a small action to start their journey?
For finding to have acupuncture?
Yeah. Well, generally to start their journey into taking a different approach to their health.
Well, they could read my book.
Yes, exactly. They could read your book. But the book might take a week to arrive from Amazon. So let's think.
Well, unless you get it on Kindle, because I do have a Kindle version.
Fabulous.
So that won't take a week to arrive. The other thing is, you have to ask yourself, really, what are you willing to do for yourself in order to get well?
Absolutely.
And I think that in order to be ready to heal, and again, this is not uncommon for people who come to me. People who come to me are ready because they've been looking and they've been struggling for a while. So I have a different audience than maybe you do, but you just have to ask yourself, well, what am I willing to do? I remember years ago, I had a client who, she came in and she had been sick, like probably most of her adult life, but she had chronic sore throats and she had sinus infections and she was sick all the time. And she wanted to figure out how not to be sick all the time. And she came to me, and she's very overweight, and I could tell there was a lot of anger in her. Right. And so when I talked to her, I went through the whole visit and all of that. And at the end I said, how much are you willing to do to get well? Are you willing to change your diet? Are you willing to exercise? Are you willing to what are you willing to do?
And this is the really critical question to ask, though, isn't it? Because I've had this experience as well with people, and they say, well, I do want to do this, and I am trying to do this. And sometimes one has to be quite, honest and blunt about these things, in terms of saying, well, okay, and people do this to me as well when I'm taking an action which isn't healthy, which is to say, well, if you do this, then this will happen. 2 + 2 = 4. But when you're inside that body, when you are that person, it doesn't matter if 2 + 2 = 4. It's something that you can't accept, almost. Like, if you eat this every day, then you're probably going to be overweight unless you increase your exercise. So, like the person you're talking about, so how did that develop, that situation? Did she agree to take action?
Well, she said she had to think about it, which I appreciated. I said, well, how badly do you want to get well? And she said, well, I don't know. I said, well, I'm going to help you get well, so you have to decide. because getting well, if getting well is your goal, you have to decide that you actually want it, right? I think I lost you. Oh, there you are. And so she thought about it, and then she began to come see me every week. And it took about, you have to keep in mind that she had been sick for a very long time, and she had a lot of emotional imbalance as well. But it took her about 3 years, and it's been 15 years, and she's become a friend. And she has not been sick like that ever again. And she's not the best with her diet. So even though that was a part of it, she struggles with diet and exercise. And so those were not the main things that made her better. There were a whole series of actions that I took with her, and I did acupuncture, of course, and she's been pretty much healthy ever since. She even had an autoimmune disease that reversed. So
that's fantastic news.
Yeah.
And what I do like about acupuncture, perhaps more than the other therapies, is that it can be very effective very fast. Although, for example, other therapies, I suppose, might incorporate more of what people call the talking cure. I found my acupuncturists were somehow, they managed to get on with the job of healing without getting involved in the talking, which can be such a huge distraction. What do you think?
In terms of the talking cure?
Yes.
I like that sentence. I'm gonna answer you, but I wanted to show you. I went and got a needle.
Oh, fantastic! Oh, thank you for doing that, because they're very, very, very fine, aren't they?
Yeah,
and you don't actually feel them going in at all.
Yeah, and so here, see how soft it is, and my hand looks bigger. My hand looks huge, but and there are a couple of things about acupuncture needles. One is this is how fine they are. There are some that are thicker depending on what style you do. I do Japanese style acupuncture, and we strive for painless. So
right,
and they don't go in very far, so they really are relatively painless. And so you were asking about, what did you ask me?
The talking, how acupuncture gets on with the job without actually having to, engage or bypass the stuff we tell ourselves.
Right.
I found my acupuncturist very, very practical and pragmatic in the past.
I think that's why it was perfect for me, because it's also, surgery is sort of the Western medicine's, I want to do something that will make a difference right now. And surgery is like that. And that's what I originally went into. And then I practiced emergency medicine for 10 years. And that's also like that, where you go in and you do something and your life changes. And acupuncture is that way as well. When I put a needle in, somebody's going to feel different, one way or another.
Absolutely.
I'm probably 85 to 90% effective in achieving the change that I try to give people. So very effective. And the talking element of it, yes, I agree with you. It's like you don't have to process or hash things out as extensively, although you can, it's a freedom you have. But the acupuncture actually balances you emotionally and spiritually as well as physically. And in fact, many of my patients who've been with me, they come in and they say, I'm stressed out, I can't handle life. And so then they come and have acupuncture and they feel better. I saw a person tonight before I came home that has a very high stress job, and she said she was starting to get irritable with her coworkers, and she said, I need you to help me because I don't want to be irritable with my coworkers. And I put in the needles and let her rest, and then I came back in and she goes, oh, did you take care of that part of my mind? And I said, well, do you feel more relaxed? And she said yes. And so, but when she came out, she said, okay, now I feel different, So, but maybe that's the most important, most significant change is that I mean, there's importance to talking as well when you're having a difficult time, and there's an importance to shifting your understanding, but balancing your energy can help your understanding shift on its own.
Absolutely. It's I suppose for me, that's the only way I can process this is for me, like I said, the acupuncture, when I was having acupuncture, it was very effective, both for my physical symptoms and for my emotional balance. Mm-hmm. However, sometimes other therapies like the kinesiology, which is also based on Chinese energy systems, the meridians, mm-hmm. There is slightly more option for people like me who are head people, who like to know the ins and outs and who like to have a good discussion about things. So, for example, my first kinesiology session, I had a wonderful woman, and she introduced me to the idea of past lives, which, is a spiritual dimension which I hadn't considered up until then. And it's amazing what different practitioners can see going on inside you. Mm-hmm. And when I say inside you, not just the physical you, but the emotional and spiritual you as well. And I know Chinese acupuncture also deals with the spiritual dimension. And what has been your experience of this?
Of the spiritual in relation to Chinese medicine?
Yeah.
Many. I actually do a series of acupuncture treatments for PTSD, which is post-traumatic stress disorder, for people who have things that have happened to them that they feel like they can't recover from. And that the acupuncture treatments actually shift it into something that is manageable, and it literally removes the trauma from your cells. And I've had many people that I've done this with, and it's changed their lives. Like, I have this one woman who was in her late 40s, and her son had been killed in Iraq. And she came in because she was having problems with her periods, and she was bleeding very, very heavily. And I went through the whole workup with her and the whole session with her, and she didn't tell me that her son had died until the end of the session. No, she told me somewhere in the middle of the session, but she had come in because of the bleeding.
Right.
And so a little alarm went off in my head. Oh, when did the bleeding start? After he died, right? And so I told her, I said, basically your uterus is crying. And she looked at me like I was crazy. And I told her that I would give her if she wanted to recover in that way, I would give her this PTSD acupuncture series of treatments. And so I did the first treatment. She agreed to the first treatment, but she didn't book an appointment when she came, for the follow-up treatment. And there's 7 in the series. And then I called her like a week later to see how she was doing. And she said that she felt different already, and the bleeding had stopped with just the first treatment.
Wow. So did you treat for sorrow?
No,
as well as the physical?
I did a treatment specifically for clearing what's called aggressive energies. It's a type of acupuncture treatment. And it was for balancing all her organs, but it helped shift that energy.
That's amazing.
And within the course of the 7 treatments, she stopped bleeding. She was able to have a relationship, and she hadn't had a relationship in years, especially after her son died. And she was able to start a new career that she had wanted to start.
Wow! And all in 7 weeks.
Changed. Yeah, like it all changed for her. And some people don't put it together, like they don't put together, like, okay, they might say, okay, the bleeding stopped, so yay, but didn't get that all those other things changing also had to do with being more balanced so that she could function in the world.
Absolutely.
But she did get it. She got that it was affecting her whole life, and that she was able to be reborn basically because of those treatments. And so when you ask, to me, the spirit and the emotions and the physicality are not separable, which is why I love acupuncture, because it does everything all at once. So if you need just physical attention, then your physical body will change. If you need emotional rebalancing, then that will change. It's amazing. It's a wonder, and I told you I've done this for 30 years and I still get excited about it.
It's fantastic.
Yeah.
And do your patients embrace other sides or other types of practices based on Chinese medicine, like Tai Chi or meditation, or what do you find?
Some of them, I try to teach people to meditate or do something like that. And of course, the way you eat and the way you exercise, all of those things are connected as well within the ways of finding balance. So the approach that I use is holistic, meaning that I use a whole list of different ways of doing things. And I also practice Western medicine from the functional medicine perspective. So I still use Western medicine, and I love the blend of what I do,
How do you blend it together, can I ask?
Like this. No.
I know it's probably impossible to explain, but it's like, it's like some people almost think of it as fire and water, don't they? It's like, how could you possibly integrate the two? But
not at all. It's perfectly, beautifully, it goes together beautifully. So for me, the foundation of everything is Chinese medicine, because it's a bigger picture. So I listen to a person's story, and I layer it in my mind according to their history and what's been happening to them. And I listen with both parts, the Western medicine and the Chinese medicine together. So that whole thing is in the initial visit, I listen on that level. And then I diagnose according to Chinese medicine by feeling the pulse and looking at the tongue, which tells me what's going on with all 12 organs. And then I take that information, and depending on what's out of balance, let's say the digestion's out of balance when I feel the pulse, then I will suggest testing on the Western perspective, like using a stool test or food allergy test or something like that, so that the testing that I do will be guided by what I find that's out of balance. Or let's say a person's kidneys are out of balance, which is your adrenal glands and your hormones. Then I'll look at their hormones. And a lot of times I'll do a lot of different testing just to make sure I'm not missing something. But
and it also reassures the patient, I suppose, as well, that everything has been looked at.
Yeah, and a lot of my patients have had a lot of things looked at, but from the functional medicine perspective, things can be looked at differently, and we can see what the root cause of something might be. And so that's where I operate from, is always looking for what is the root cause of the condition that the person has.
So are you saying, for example, if somebody has a problem with their digestion, for example, their doctors might not have considered the relationship or anything being out of order with other organs, so they haven't done the tests, for example, for the adrenal glands?
Right. And
so that's something you would do.
Yeah. I have a whole philosophy on what I call the triangle of wellness, which is a blend of the Chinese and the Western medicine together, taking your immune system, your hormones, and your nervous system, and it as a triangle. If these three things are in balance, then you will have the ability to heal. Because if your immune system is functioning and your nervous system and your hormones are functioning, then whatever else is going on, you're going to be able to have the energy to get the healing that you need.
So that's kind of like the foundation for health in the person.
Yeah, well, yeah, and then it comes out of my years of doing both Chinese and Western medicine. So
that's wonderful, Dr. Shiroko.
yeah.
So I understand that you're going to be promoting your book in Europe, perhaps in the fall. Is that right?
I would love that.
Well, I want to urge everyone to check out Dr. Shiroko's book. It's absolutely fantastic. It's one of the best things I've read in terms of mapping a journey. And when you first get ill, it can seem like it's an impossible journey and you're never going to get better. But you just need, as somebody said to me recently, the recipe, and Dr. Shiroko's book is definitely that. So I want to thank you, Dr. Shiroko, for joining us today.
Thank you for having me. Yeah.
And we will speak again soon, I'm sure, and find out more about Dr. Shiroko's book tour. But goodbye for now.
All right. Thank you so much. Take care.
Thank you.
Bye-bye.